Today I'm talking with Dr. Karen Tonge, who is a lecturer in the Early Years program at the University of Wollongong. And I'd love to talk to you about your research and also thinking about it from a family perspective and from an educator perspective. So can you talk about your research, please?
Yeah, so I am an early career researcher and I've recently completed my PhD. So thank you, very exciting. So my research focus was children's physical activity in early childhood education and care services. So with children's physical activity, we were looking at environmental influences of children's physical activity, including the role of the educator, so the educator's influence on children's physical activity. So this is a really important area. So children's physical activity, and for children to be physically active, is critical, and it's critical throughout their life. So being physically active supports their emotional development, their cognitive development, their health, their well-being, cardiovascular health, bone health, and so forth. So, and we know that the early years are critical, and it's a sensitive time for learning and development, as well as developing really positive behaviours. So we took the opportunity to look at early childhood education and care services, knowing that many children go or attend an early childhood education and care service. So we saw this as a valuable opportunity to examine what was happening within these spaces. So the recently released Australian 24-hour guidelines for movement for children tell us that children should be active for at least 180 minutes a day. Okay. Within that time, there should be 60 minutes of moderate to vigorous physical activity. So that's when children get a little bit sweaty, a bit of huff and puff, a little bit more energetic than just walking or playing or whatever it might actually be. What we're actually seeing is that children aren't meeting these guidelines for physical activity, and they're not meeting the guidelines for 15 minutes per hour of the huff and puff activity in preschools. So we wanted to know why. So my research actually involved going into 11 services where educators as well as children were wearing accelerometers. So the accelerometers measured their physical activity. This was of course very interesting for the educators as well, because their physical activity is also really, really important.
Yes.
Yeah. We were also tracking their movements around the centre. So we used a global positioning device where we actually were able to monitor and examine their movements and their location and where physical activity was actually happening. So it was a very interesting study. So we did have a large sample size, and from that we actually found that there were some contributing factors to children and educators' physical activity. Now I like to use the concepts of time, place and space for the results of our study. So what we actually found was the more time that children spent in outside environments, the more physical activity they were engaged with. Now this is probably not surprising because we know that outdoor environments afford many different opportunities for play. Perhaps running, the freedom of movement, jumping, climbing a tree, riding a bike. And so we did find the increased amount of time that children had in these settings was actually related to an increase in physical activity as well. So that's the time factor. I also like to think of it as the space. So what is actually happening in that space? Is it the size of the space? Is it what is actually within that space? So what we actually found was that even though a larger service did have a moderate impact on children's physical activity, it wasn't significant. So this is really
That's very interesting. So even though the size of the centre was larger, which we could think would lead to more activity, that didn't have that result.
Yeah. So it certainly did have some effect and some relationship. But what we're actually seeing is what really matters is what is happening within that space. So it didn't necessarily matter how big the space was, but what mattered was what was happening within that space.
So it's like the Daryl Kerrigan, I think it is, in The Castle. It's what you do with it. That's right?
Absolutely. And so this is where we were seeing the educators had a really key role. So they had a place in this space as well. So what we were seeing was when educators were more active, children were also
Okay.
more active as well. So it was particularly evident with sedentary behaviour. So when educators were more sedentary, children were also more sedentary. And that was the most significant finding in the relationship between children and educators. So it's actually showing us that if educators and parents and family members can become involved in children's play and encourage active play, it will actually increase and support children's physical activity as well. So the interaction aspect of what is happening in that space is really, really important.
So then in thinking about that, because we can think about families and educators, for example, it's also that you're saying that the more active the adults in children's lives are, then the more active the children are. But there must be also other things. I mean, we may have environments where adults can't necessarily be active, but children still need to be active. So how can they can encourage children to be more active?
Yeah, well, there's a few ways that we can encourage children to be active. Research has shown that providing experiences and opportunities where there's mobility and movable parts, such as a skipping rope, a ball, a bike, this will actually increase children's physical activity as well in comparison to fixed equipment. Of course, fixed equipment is very, very important for children's physical activity as well as strength and coordination. But what we're seeing is when children have the opportunity to play with a ball, a rope, a bike, even drawing with chalk, it's been really, really significant for children's physical activity. And these are things that can be done at home as well. The affordance of chalk drawing on the path outside, which is very accessible and it can just wash away when need be, or even using masking tape inside the home, up the hallway. Plan out a hopscotch, and then as children go down the hallway, they can do the hopscotch, which increases their physical activity as well. Yeah.
And what about in thinking about risks? Sometimes people are fearful with activity that children may be hurt, or so. Did your research show anything about the perceptions around risk, or how people were seeing that and that had an impact?
Yeah, we didn't delve into that specifically, but what we were certainly seeing, and I know from experience, we're seeing that when children are afforded the opportunity to take a risk, they're able to manage that really well themselves. And sometimes when there are safety mechanisms around a child, it reduces their ability to take a risk, and they become very cautious and unsure. But when children are afforded the time, the space and the encouragement to strive to do a little bit more, they do tend to become more active and more involved in the play as well.
And with the use of the tracking devices, did you find that educators were more active as a result of having those, or did they on reflection?
Yeah, this was a very interesting point, something that we thought about considerably, and we did actually do a lot of research and a lot of discussion with other researchers that had used similar devices as well. What we actually found was that it was quite obvious that educators quickly fell back into normal patterns of behaviour. So within a 10-minute, 20-minute time frame, because I was there to observe and I did actually do some videoing, it was actually clear to see that educators tended to fall back into familiar patterns. And because the data collection was over a week's period, there was a significant amount of time where there was some recording taking place. So, yeah. Another important aspect of the research that we found was, and this is something that can really be used at home and useful at home as well, was when children had opportunities to move between environments. So when there was a free-flowing routine, so services where children were allowed to either play inside or outside, and it was their own choice and responsibility to make that decision, that is where we saw an increase in children's physical activity. So it actually allowed children to move frequently or less frequently between the spaces. And when they did, what we were finding was that they were having sustained periods of time in activities such as climbing a tree or engaging in a game of soccer, and it was uninterrupted time. So this certainly saw a significant increase in children's physical activity as well. So for services, allowing some free flow in their day, even a small aspect of the day, will actually see an increase in children's physical activity. Of course, we know that some children may be more inclined to be inside or to do other activities, but this is where the role of the educator or the parent is really important as well, to be aware and to encourage. And as we know, if an educator's physical activity has a relationship with a child's physical activity, particularly with sedentary behaviours, having different opportunities during the day, such as at transition times for active movement, or little mini breaks during the day where you play an active game or engaging in music and movement that involves physical activity, this is really significant as well.
Yeah. So it really speaks also to children's agency and choice as well, doesn't it? If there are those opportunities available, children will have a sense of engaging in an activity for a longer period of time. Now, some homes, for example, and some early childhood settings don't necessarily have the capacity to have a kind of indoor-outdoor free flow. People might live in apartments and they need to actually go out for play, or likewise some early childhood settings don't have that free flow area. So have you got some ideas?
I suppose the main things to consider, and I like talking about utilising moments in time for intentional teaching and experiences. So, for example, if you are going to the shop or doing the school drop-off or pick-up, parking your car just a little bit further away than usual, having that opportunity to walk a little bit further is something that's going to contribute to the amount of physical activity you get during the day. Even the availability of different resources in your home. Often with my children, like we'll scrunch up a ball of paper and, we'll throw that around the room, or, we might play, as I say, a game of hopscotch on the floor, or a game of hide and seek, or blow up a balloon and play a game with balloons in the room where you sort of have to keep it off the floor and that sort of thing. So it's about little incidental moments, so it doesn't have to be a whole block of time. We're looking at 60 minutes across the day of huff and puff.
Yeah, something I was going to ask was, does it differ for different ages, the amount of physical activity, or is it just a blanket sort of 180 minutes?
It does vary. It does vary right from birth up for the older age groups as well. So of course we would be expecting less screen time for the babies and toddlers, no more than an hour of screen time for children 3 to 5 years of age, and then of course also the levels and the amount of physical activity does vary as children develop and get older as well. So
well, there's some great ideas there. Given that physical activity is obviously so great for children and for adults as well, and it does perform such a wonderful sort of opportunity, and it's fun as well to be out. And so what's your one big tip for creating an environment that enables children's activity?
What I really think is just the affordance of time and taking a moment to be aware. A moment to be aware of the time, the space, the place, what is available, how much time is available, and what we're actually doing within the space that we have. So I think the research certainly shows that it's possible to have physical activity wherever, however we are, but I think we just need to be aware of those little moments that could create physical activity opportunities for us and for children.
You've talked about adults being a part of enabling children's activity. What about the interactions and the quality of those interactions that adults have with children?
So we know that quality experiences are critical for children, and quality relationships are really, really important. So what we actually studied in my research was the quality of interactions between educators and children in an outdoor environment. And we looked at different variables. So we compared a centre that had a structured routine we compared a centre with a structured routine compared with one with a free-flowing routine. We also looked at the amount of time that was spent outside, and what we actually found was the quality of the adult-child relationship, which we measured with a tool called CLASS. CLASS is an assessment tool where we looked at emotional support, organisation of the environment, as well as instructional support, such as intentional teaching. So this scale we used to actually assess and examine what was happening in the outdoor space when we looked at different service types. What we actually found was the quality of educated child interactions was greater when there was a free-flowing routine, so the children had access to many spaces within the indoor and outdoor environment, and also when there was more time. So once again, what we're seeing is the affordability of a child's sense of agency and choice, as well as an educator's freedom of movement as well as the affordance of time. So what we're actually seeing with the quality of those interactions is that if there's uninterrupted playtime, if there's sustained playtime, there's a rich and meaningful interaction that occurs, which then in turn increases children and educators' physical activity. So that has to be a positive. And when we look at the quality of interactions, this is going to be critical. So children can develop that supportive relationship and they can trust their educator and they have that modelled approach where they know that the educator is going to be active, that they may engage in that game of soccer or hide and seek or encourage climbing the tree. So really important to think about what is actually happening in our spaces and how we're actually structuring the spaces that we provide.
Wonderful. It sounds like this is an experience that's great for everybody, for adults and children as well.
Yes, it is.
Well, thank you very much, Karen, and thank you for joining us with our friendly wombat today.
Thank you.